afternoon of May 8th, and we are coming back to S53. So some concerns this morning were raised. And I'll be honest with you, concerns I had not heard of before. I think we were all a little surprised. This bill went through the Senate, multiple committees, and concerns weren't raised. And I've been thinking about the fact that I keep having to remind myself that we are a policy committee, and it's our job to put good policy out. This bill will end up going to both Ways and Means and Appropriations, our money committees. And I've been thinking about the policy that's in this bill and what I believe is good policy and policy that we have been working on for years in this bill. And there is one item that I really do believe is policy related, and I completely and totally understand the difficult position that our Agency of Human Services and our Department of Vermont Health Access is in right now regarding amending our state agreement in a choppy federal water where, we're not quite sure what's happening. So I've asked Jen to prepare an amendment, and she'll walk us through that amendment that I am hoping will alleviate concerns from our Agency of Human Services, legitimate concerns around the timing of seeking our state plan amendment. Thank you. SPA. That's right. It's a SPA.
Great. You want me to put language up? Yep. Great. Jen Carby from the Office of Legislative Counsel. Here is language. It's posted on the House Healthcare Committee page. It's not a strike all. It's just a couple of instances. So this is S53. This is the doula bill. The first instance of amendment would strike out Section 7 on the state plan amendment and put in a new Section 7 that would give a not later than. So there was no date in the bill as it came over from the Senate. This would say not later than July 1st of 2026. The Department of Vermont Health Access shall seek a state plan amendment. I took out the language saying if needed because we understand it is. So shall seek a state plan amendment from CMS to allow Vermont Medicaid program to provide coverage for doula services in accordance with that new statutory section. And then in the effective dates, for the effective date for the Medicaid coverage, it would now say it will take effect on the later of July 1st, 2026, or approval of the state plan amendment requested pursuant to Section 7. So that second piece isn't appreciably different, but it's getting rid of the ambiguity about if a state plan amendment is needed.
And my hope is that not later than by telling them that they have a year to seek the state plan amendment, that it will allow them to maybe get through the fall and the winter with federal budget time, where they will know a little bit more about where they stand and whether or not this is a good idea. Also, if they need more time, we will be back in January, and they can come to us and ask for additional time if they feel they need it. So, any thoughts on this?
Does anybody who doesn't approve of this amendment? Does anybody not approve of it?
In here?
In here.
Just give us some time to look at, compare and contrast what we had earlier and.
All the time you want.
I can try to put them up side by side if that would be helpful.
Yeah,
I'm have to see if I can see it well enough, but
and
just a second.
are we going to hear from Diva eventually?
Diva's certainly welcome to comment on,
I'm happy to provide a comment to the
Yeah.
committee. Absolutely, Madam Chair. For the record, Alex McCracken, Department of Vermont Health Access. We view this as a big step in the right direction, and we're really appreciative of the work the committee is doing to give us this flexibility and a little bit more runway to seek the state fund amendment. As the chair noted, this is a tumultuous federal environment. We want to exercise every caution available to us, and we appreciate the date change in the amendment.
So you support it?
The amendment is a step in the right direction. I'm not able to comment on the change in position of the bill itself. There were other outstanding issues that this amendment does not address, but this amendment is greatly appreciated and very much helpful.
support the amendment.
Okay, I will attempt to put up my, I have to do my actual.
You fainting?
I'm so tired.
So I put these side by side. So that you can see, so on the left is the new version with the date. So it's adding in not later than July 1st, 2026, which is not in the bill as it came to you. And then it still both has the Department of Vermont Health Access shall seek a state plan amendment from the Centers for Medicare and Medicaid Services. And then in this original version, if needed, and here it just says to allow. So if needed to allow, just to allow Vermont's Medicaid program to provide coverage for dualist services in accordance with that statutory provision as added by this act. So it's really just the addition on the amendment, the addition of this not later than July 1st, 2026, and dropping the if needed by over here. Those are the changes in this section, and then I can scroll down to the effective dates if you want, but.
And so this is because we know it's needed. And also it gives us some wiggle room so that if next January Diva is concerned about this, they can come to us and say, look, this is not a good idea and we could change the law. Will we change?
Right,
the law?
it gives them some flexibility on the timing. There was no date specified, so arguably it could have started not later than or anytime before or after July 1st, 2026. But this gives them, you know, a year plus to choose their opportunities, or to come back to you during the next legislative session and say, we need more time or this is not workable.
And we would, is this session law?
This particular piece is,
Yeah, so then we would just change our session law next year. Like when we passed it, it wouldn't like be changing statutes, it'd be changing session law.
it depends what you chose to do.
Oh, okay.
I mean, yes, if it were just a matter of changing the date, yes, if you were changing some of the Medicaid coverage requirements.
Or the professional regulation stuff, it would.
Professional regulation stuff, yeah.
All right, thank you. I just want to, I think my point is just that it gives them some time, but it also gives them time to come back and say, stop, don't do this if it's really going to be dangerous.
And then for the effective date, struck out B, you put in a new B. So again, section 5, that same reference, same description shall take effect. And in the bill, as it came to you, it was on July 1st, or if a state plan amendment is necessary upon approval of the state plan amendment, whichever is later. Here I've moved the later, but it still shall take effect on the later of that same date, July 1st, 2026, or approval of the state plan amendment. And I took out this if a state plan amendment is necessary because we know it is, and then just clarified that requested pursuant to section 7, since that one is specifically directing them to do it.
So Jen,
Oh, wait, what,
Go ahead,
Woody?
Another question. There was some concern with the old bill about financial issues related to DEPA. Is that still a concern? Or does this amendment help in that regard? Probably.
This amendment doesn't address that portion of my earlier testimony, but it does allow us to come back, as Representative Chena said, next session with a clearer view of the federal landscape, as well as the governor's recommended budget for 27.
And we can come back and
Absolutely, absolutely. If Diva comes back to us and tells us, yeah. Brian,
But it is allowing us to move forward with the certification of doulas and validating their work and acknowledging their work and allowing their profession to move forward in our state with greater recognition.
Yes, the certification is for a subset of doulas. But yes, it allows the rulemaking process to move forward
Yeah.
so that the certification process will be available in.
Yeah. So we're not holding everything up, is what I'm saying. We're delaying the financial piece, but we're allowing everything else that, I don't know, not that doulas need state legitimacy, but that's what this is giving, you know?
and I would point out, we may not even be delaying it. I mean,
Right.
Diva may say, oh, we think we're safe to go forward with this, and they can start that at any time. But if they need more time, then they can come and ask for more time, or this gives them time to gauge the federal landscape a little bit better.
As well as work with OPR on a certification.
Yep, absolutely. Through the
Representative McCollum have a question?
No. What was said is what I was gonna say.
Say it again, even longer.
Um,
So I
Need to
guess,
get ready for tonight.
so I'll take a straw poll on, whether or not we need, amend S53 with draft number 1.1. And all those in favor? Okay, 11-0-0. And if somebody we would entertain a motion.
I move that House Healthcare vote favorably on S53 and act relating to the certification of community-based perinatal doulas and medical coverage of doula services. As amended.
Second.
All right, clerk, call the roll.
Representative Tina.
Yes.
Representative Critchfield.
Yes.
Representative Demar.
Yes.
Know what that
What did you
means?
just do?
You went like, yes.
Representative Golden.
Oh, yes.
Representative Hope.
Yes.
Representative Page.
Yes.
Representative Powers.
Yes.
Representative Rebecca.
Yes.
Representative McFarland.
Yes.
Representative Black.
Yes.
Passes on a vote of 11-0-0.
Can I explain my vote? I'm voting yes in honor of Representative Cordes.
Oh,
The years of work you have done.
thank you.
And because of that, I would like you to please be the reporter of this bill.
I would love to, especially since I've already started working on that.
Great. You need instructions on how to send that to the clerk's office. All right, thank you, everybody. Thank you. Okay. Really, we're done with committee for today. I know, I'm sorry.
Before we go off live, can I just ask a question about the committee business, which is this the last bill in committee?
This is the last bill that, except for the Senate House bills.
The ones in motion?
Yeah.
But this is the last one currently in our committee.
Well, except for all the other.
No, currently in play in our committee. So that means
Yeah.
from this point till the end, whenever that may be, of the session, I'd say,
Yeah.
that it's gonna be the bills that haven't been signed yet bouncing back and forth, but we have at least moved every bill out that we could.
Yeah, and I don't know if you've heard, but it's possible that we may have a lot of spare time for committee work. And tomorrow during committee, we're going to be talking, we're gonna have committee discussion, conversation amongst ourselves around maybe some testimony that we might want to kind of start listening to. We could line up for things that people are interested in working on maybe next year.
For like a
So-
public hearing.
Okay, we're not doing a public hearing this year. Go ahead, say it. Okay, thank you. We can go off of